Sensory Empower podcast. I'm Bethany, your host. I'm a holistic occupational therapist with over a decade of experience in supporting individuals helping to transform their world through sensory empowerment. This podcast is your guide to the transformative world of sensory storytelling, holistic tools, and empowerment strategies. Hi, everyone, and welcome back to the Sensory Empower, the podcast, season 2. And I am so excited to have Lola MacLean here from Halen Empowered. And Lola's going to share some really intriguing information about gut health and nervous system. So Lola, can you give us a little introduction of yourself and your business?
Yeah. Well, first, thank you for having me. I always love being able to connect with local people too. So I am by training a family nurse practitioner, and through kind of my own health experiences and listening to patients for, over a decade with different complaints, jumped into the functional medicine world and really loved all the discussion around the digestive system and how it can really be a big place of healing for people, right? Like all health starts in the gut. So that is why I now do what I do as a functional medicine consultant and gut health coach.
Beautiful. It's so many beautiful things. And you kind of, shared a little bit of that self journey of kind of how that brought you into your business. Was there really like a specific moment where something really shifted and that helped you really understand healing?
Yeah, absolutely.
Big pivot moment.
Yeah, absolutely. There were a couple big pivot moments. I think, for most of my life, I had struggled with both anxiety and digestive issues, right? I was always the constipated kiddo. We'd go on trips and my dad would always bring prunes, and still don't like the taste of them because of all the associations with it, right?
Yes.
But like that kind of progressed in high school and college, and I finally got a diagnosis of irritable bowel syndrome, right? Or IBS. And for a long time, with what my providers were telling me, what I learned in my school as a nurse practitioner, IBS was just kind of like something you live with, right? So regular constipation, regular bloating, regular like food reactions to things. It was just part of my normal life and what I thought was normal. And then I had all my workarounds, and kind of fast forward to seeing a lot of patients as a primary care provider and hearing the exact same stories that I was going through, but from older individuals, and being like, well, I've lived with this for 20 years, 30 years. Now I can't eat these things. This is just getting worse, but everything is normal. And, all these just heart-wrenching stories where it's like, this doesn't get better. Like, this is my future. And wanting to really help these people, I started digging more into functional medicine and things that way. So that was kind of a spark. And then I got pregnant, COVID hit. My daughter was born right at the beginning of COVID. There was a lot, being a new mom, being going back to work in a different healthcare landscape, right? Because COVID shifted just the way healthcare works. All of that added stress and pressure and everything, just everything came to a head. My anxiety was at an all-time high. My gut issues were awful. I think there was a period where I hadn't pooped in pretty close to 2 weeks. And I was like, this is not okay. Right.
So uncomfortable.
Yeah, it was awful. And I saw my doctor and she's like, it's just IBS. We need to start you on some medications. And from what I had been learning with functional medicine, I was like, I don't think this is it. I want to go this other route. So that was that moment where I was like, I'm diving headfirst into this. I will work on myself first, and then I will start working with other people if I can make it happen. And it did. Yeah. It was a whole, not really a 360. I guess it was a 180 because it's completely different, but I don't know. Yeah. One of those moments.
Well, and I think I shared the word uncomfortable because I could only imagine like what your body cues were of having that retained for so long in your body. And when I chat with my clients about like gut health and things like that, we're thinking of the sensations of our body. What does it feel like to sit on the toilet? And, you know, some kids really can struggle with even the sensory facets of sitting on a toilet and trying to go to the bathroom. So I think about interoception and how our eighth sensory sense and how all of those cues from our intestines and our bladder giving pressure, and if we have a distended gut and all of those deep pressure pushing, how it can feel so uncomfortable in our body. Like we're not going to be able to have emotional regulation skills and be able to self-regulate. So I think about those like early subtle like cues from the gut from like an interoceptive perspective. Do you have any like sensations, and we can like brainstorm together too, of like what would encourage just thinking about the sensations to encourage people to like track when it comes to like that gut feedback?
Absolutely. Because that is one thing that I see a lot with the clients that I work with is there's been almost a shutting down of those sensations for such a long time because it is uncomfortable and it puts this undue stress on your body. So even if like you're not mentally stressed out or taxed, like you're still physically stressed out and your body goes into that fight flight mode irregardless, right? And it's a lot of times it's retraining ourselves to feel again, right? Because we've disconnected as adults. A lot of adults are just like, I don't know what you're talking about. I don't have the words to describe the feelings, right? Like I'm bloated and that's about as far as I can go. Yeah. So I think like early, like you're talking about like early sensations, right? So like before the bloating, like, you know, really noticing with curiosity, those things like that stretch, right? Is there a stretch? I think one of the things too with noticing sensations is not, I don't know how you feel about this, but I don't like giving things a good or a bad, right? Like really kind of having that neutral language. So we don't start to spiral, right? Like, oh my God, something's wrong with me. What's wrong with me? What's wrong with me?
The art of noticing, the subtle art of noticing. Yes.
Subtle art. Yeah. So like stretching, pressure, a warmth, you know, do you feel a little bit of a movement, right? Is there, you know, this might sound kind of gross too, but like, can you feel really the bottom of your colon, right? Like where things start to meet the outside. Like, can you feel that ring? Are there sounds associated? A lot of us will notice like those high pitched gurgling noises, but like, can you hear other little sounds or other little sensations that are going on? Yeah. I don't know what words are coming to mind for you.
I think pressure definitely, I think is one. Tight versus loose. I think that contrast is also another one I notice a lot when I'm brainstorming stomach, gut, bladder sensation, just from that kind of interoceptive lens of, ooh, curious, what is this feeling?
Yeah.
I know when I just do some like bladder check and bladder awareness, like just locating and pushing and providing just external deep pressure helps really to increase that. Wait, whoa, okay, yeah, that thing that maybe I've detached to because it's either maybe I've had a lot of constipation and I've been kind of disconnected from that part of my body. If I bring my hands to it, and I add just a little bit of gentle pressure, I can then start to have a lot more feedback. So that's one that I like to build in, especially with kids, just to do like bladder checks or bringing in curiosity, thinking about like full versus empty, contrasted as well, of kind of thinking about even bowel or bladder. Is it full? Is it empty? Is it starting to get really full? I've had some clients describe, you know, it just feels so full, I don't know what to do. And that's been a really interesting piece. And then, you know, chat with the family and they're like, yeah, there's tons of history of constipation. And it can just be that like, I'm not sure what to do. I will hold.
Hold it because this is unsafe, right?
Yes.
And I don't have an understanding. I think too, like when you're describing that, I would also encourage like a location, right? Do you feel like, are you feeling things more at the top, like kind of that upper GI area? Feel things more in the chest? Do you feel things more in the low belly, right? Or is it on the sides or even in the back, right? A lot of times, especially adults with like pretty chronic constipation, back aches are a very common complaint just because of that pressure on the spine.
Oh yeah, no, that totally makes sense. Just the expansion all around. Things are feeling. I know. I'm just imagining it now. I can't get out. Pushing to the side.
Yeah.
I'm very animated, as you're finding out. I think it gets me thinking about like the sensory facets of like internal cues, right? If we're sensory sensitive and we are more primed to feel overwhelmed by the sensations in our world, we can also be overwhelmed with the internal sensations in our world.
Yeah.
So those like really strong feelings, like urgency to have a bowel movement or bladder release, bloating, like sometimes can be fast, especially if there's lots of facets that you support with the digestive piece.
Yeah.
So I'm just kind of thinking those like nervous system first strategies to kind of help someone think about, instead of I'm reacting, like you kind of mentioned, right? Trying to reduce that reaction, reduce that judgment of the sensation, and then thinking about the curiosity of, oh, what does this mean? Like, what are maybe some of the nervous system first strategies that you use in your practice?
Yeah, that's a really good question. Definitely that, again, that curiosity piece and naming that sensation without there being necessarily a meaning attached to it, right? Like, and I think for a lot of adults, especially sometimes those of us who are very sensory sensitive, we can go into this like, well, what does it mean? What does it mean? Kind of a thing really quick. And so that in and of itself, because I think we might talk about this a little bit later, but that whole gut brain piece, right? When we're now adding this like, oh my God, what does this mean? Like piece, we again kind of go into that fight flight mode and it shuts down our digestion even further, right? So that is a big one. I think the other one that I really hone in with clients on is that like safety first piece, right? So really like coming back to the body and feeling safe in it. If that, because there's a lot with like, is it okay to do this right now? Or is it safe to have a movement? Or is it safe to really like be digesting our food? Is there, because there's, at least with adults too, and I don't know about the children you work with, but trauma can be a really big part of this, right? And so even like unaddressed trauma can go into a lot of just like we hold on and retain and create a huge issue that way.
Very much, very much. And I think that dissociation piece, right? I think I see a lot of individuals that do have traumatic histories, and there are many times where I'm just kind of disconnected from my body. So I don't have those interoceptive cues. I'm in freeze mode. I'm just kind of away and maybe a little glazed over, or maybe very quickly and like to stay in sympathetic. That's another really interesting theme that I've noticed working with individuals that have had and experienced trauma. Those two nervous system states appear to be most common. And if we've had scary experiences, or if we've had many moments in our life where we've needed to have self-preservation, we were relying on our nervous system to go into those states to protect us. So it's a known and sometimes very familiar nervous system state. And so trying to even practice some of those calming strategies at first sometimes can be like, I don't want to feel calm. Calm is novel. It can feel really, I don't know what to do.
Right? Yeah. Because especially like in childhood, that's when so much of that nervous system gets primed, right?
Absolutely.
And so you have a lot of adults walking around who maybe were in some very uncomfortable situations as kiddos and like we haven't really addressed it, or it was kind of like swept under the rug, not a big deal, right? And now it's like, oh, this is how I operate. And it is so hard to actually slow down, so hard to actually be in my body, so hard to actually sit with what I am feeling. Yeah. But also with practice, it becomes the new normal. So it's kind of like getting to that point where it's like, this is the new normal can be really hard.
Yeah. Yeah. But when you make it through those moments,
yeah,
you're just like, man, like, yeah. I remember a family just be like, and now he's like noticing that the water in the bath is hot and sharing like, that's too hot. And I was like, it's because he came back to his body.
Yeah, he can feel it again. Yeah.
He can feel it again.
Yeah.
And we were all just like, oh my, this is amazing. Like what felt so subtle was like, this is massive. This is such a huge ability and capacity. And then all the things just ripple effect of being able to have better emotional regulation skills and being able to process the sensory input in the environment with more ease. And there was a big piece with bowel movements as well.
Yeah.
Really, really big emotions because of a lot of constipation. So that was just really all tied in. It's all tied in. We will totally get to gut brain conversation because it's deeply interconnected, as we both know. And it's so fascinating. I think when like we're thinking about like that distress piece and nervous system connection, right? I'm just trying to think of like facets when we're thinking about like gut distress and those cues of our body of like emergency, emergency, something's not right, something's painful, something's like a really strong feeling.
Yeah.
And just like how to determine that level of like nervous system regulation or awareness work before being able to access some of those deeper interventions. What do you feel like is that ability to kind of dive into like this foundational piece, and then when are we ready to dive into maybe a little bit more deeper, maybe higher level cognitive interventions or higher level mindfulness based interventions? Just love to hear your thoughts on that kind of progression of support and interventions.
Yeah, so I actually have a really good client example for this one because one of my clients who we're still working through this piece, but she actually had seen a couple of functional medicine providers before, right? Had done pretty extensive GI testing, lots of lab testing, and she had been put on a pretty extensive, like we call them protocols, but so they're basically like, for a lot of people, they're supplements, right? Like here's your 20 supplements you're going to take for the month, which, that's a whole nother rabbit hole to go down with functional medicine. So she had done, so that had all been done, right? She had gone down that road, tried a lot of those things, but she felt so unsafe in her body and so disconnected from it that she was pretty much reacting to everything that was an external source and also wasn't actually having any results from things, right? So right now, what we're really working on is getting those sensations back and like coming back into her body. So like just tracking, like, do you notice when you need to have a bowel movement, right? Is there that ability to have that sensation present? Or, when you are starting to feel bloated, where do you go, right? Do you start immediately like trying to doom scroll and disconnect and go somewhere else? Or do you try and come back? And so we're working on that coming back and tuning in with it, right? We're rebuilding that connection to her body and that feeling of safety and curiosity. And then once we get that part back, right? Because now we're hopefully not so much in that fight flight mode because we're not disconnecting, right? Then that's when we can add in all the like, okay, let's start with working on the actual process of digestion, like the digestive enzyme piece, and let's try the magnesium for motility, and let's do all these other little things, right? That now we can support it. But if we're stuck in that, like, I can't figure this out, I can't go, I can't, like, we're needing that nervous system piece, we're not going to be able to digest it all, right? So you can focus on the digestion all you want, but it's not going to get better until you actually can get out of that fight flight mode on a more regular basis, right? I don't know if that answers your question now that I'm thinking about it.
Well, and I think that just like highlights the importance of this foundational work, right? And that's the professional brains getting together to be able to get to the root cause. What is the underlying piece before we are able to put in all of these maybe additional strategies, supplements or magnesium and things like that, before from sensory world, before we can get to these higher level accessing of sensory tools and self-regulation strategies.
You have to start at the bottom part, right? You have to actually be able to tap in and feel, because your body only speaks to you through those sensations, right? And the symptoms that you get from those sensations. And if we can't identify them or we aren't able to listen to them, nothing else is going to happen. It's not going to get better. You can't get better.
Yes.
Without being able to do that.
Yes, absolutely. And that kind of goes into this next curiosity of, all the things in our life that we do in daily routines. We've got our sleep and making sure our sleep is good, getting enough movement. So we've got some twisting and rotation and feedback, right? Nourishment, having our mindset, and then this foundational nervous system work. Do you notice that? And we've kind of talked about nervous system as that foundation of the pyramid of the house, right? That base. Is there one that you also notice, maybe like the second tier, that maybe creates another really big shift with gut symptoms? So maybe that base of nervous system regulation, and then kind of, you mentioned supplements, but are there any other big pieces that you notice like, wow, that really helps with like a massive shift?
Yeah. One of them, it's kind of like a combination one. And in my world, we call it eating hygiene, right? So that's kind of doing a couple of things together. And the first and biggest part of it is really actually being present with your food, right? Because again, if you're in that fight flight mode, you're not supposed to be digesting. And so if you're going to eat anything, you're immediately going to get bloated, or, you don't have the acid to actually digest stuff, and you become constipated later on, and things just don't sit well. It feels uncomfortable. With getting into that parasympathetic state, that rest and digest state, right, then we can actually digest what we're putting in. And so with eating hygiene, it's really sitting down for meals, right? Like being present, not eating on the go, not eating while you're standing up, not eating at your desk, not rushing through things, not chugging a lot of water or liquids at your mealtime, right? Because so that's going to dilute stomach acid. That's going to add volume to your stomach, right? So if we're thinking about things stretching, maybe beyond their capacity, when we're downing a lot of liquids, that's going to stretch our stomach out and make us feel really uncomfortable. And then also like starting to really chew and really like engage with our food that way. So like having thorough chewing, things taste sweeter, noticing the tastes of our food. And then when we're chewing things before we swallow them, that makes our digestion easier, right? Rather than just like eating like a snake, which a lot of us do. Just like get it in. We have a space to really be like, oh, wait, hold on. It takes longer. So then you start to notice like, oh, I'm full, right?
True.
Or, again, going back to that taste, like things taste sweeter because there's more surface area, right? So the actual enzyme amylase has more ability to get in there and make things taste better. But also like, as we notice when we're swallowing things, like how is it going down? How is that feeling? How is it sitting? Right. So just really being present during that time can make a huge difference. Like that's one of the biggest things for bloating that can help people without, having to go down this whole rabbit hole of supplements and things that way.
So much sense. Is there air? Is that the piece of, if you're eating really fast, you're swallowing more air?
Swallowing a lot of air. Yeah. Yeah. And you're like, oh, why do I feel so gross? Like, well, there's a lot of stuff going on.
Yeah, you're eating like a snake. Stop it. Yeah, no, just kidding. I've got that visual in my brain now. I love it. That's a good one. The python, yes.
I know. I always see like, I don't know if you've ever read The Little Prince, but
I have.
So the picture he has where the snake and the elephant, right? I just always remember that. I'm like, oh, it's a hat. Yeah.
I love it. I feel like when the like awareness of swallow, right? I was just thinking about like times where I've like felt the extreme thirst and have like chugged a lot of water, and it's immediately like that immediate cue of I am uncomfortable. was maybe not exactly what I needed.
Yeah. And then
so
you
slowing down.
You throw in your food with that too. And that's like, there's no space. There's no space. Yep. So
yeah. The dilution of the stomach acid that's a new fun body science fact I've never heard of. It totally makes sense. I love that. So thank you for sharing that with everybody.
You're welcome.
Slowing down, mindful eating, key support. I love it. Any other like body cue, like breathing or like movement, vagal toning, those sorts of tools that you interlay into some of these facets for support too, Lola?
Yeah, absolutely. Right. Again, kind of going to that sympathetic versus parasympathetic mode, right? And the vagus nerve being that primary one that we think about when we think about parasympathetic, and especially that gut brain connection. So anything that works on the vagus nerve, humming, gargling, doing even like ear lobe rubbing, right? That's one that'll stimulate it. That's my favorite one for using like when I'm in public. I'm just like, okay, because this isn't weird, but it's like a little weird, but not weird enough for anybody to be like, what's wrong with you? Those are all good.
Yes.
Yeah. And then definitely movement, right? There's a lot out there as far as even just like gentle stretching and yoga for things like constipation and bloating, because moving that can help to shift where the gas goes and those kinds of things. And that's really good, I think, for connecting back to the body, because a lot of the practitioners will guide you through like, how is this feeling? Do you feel this sensation? Which I think is just helpful cues too.
Yeah, to bring the cues back in is like twisting, like a gentle twist to allow a little bit more of that kind of motility. That'd be one that might be added.
Yeah, that is a good one. Also, really like child's pose. Is a really beneficial one too, because the way that like when you're laying there and you have your kind of belly on the knees, there's space for it to go, but there's also a little bit of pressure from your legs that helps to kind of like move things a little bit more, right?
Nice. Yeah. I go into child's pose a lot. I feel like it's a really soothing, it's very grounding for the body. One that I love.
I know. I always like because forehead on the ground, you're like, okay, everything just, I don't know. I always get this feeling that things are really just like draining off of you. Like,
I add in a lot of humming when I do child's pose, or if I'm teaching kids yoga, and I add in, we're going to do bee breath and child's pose. Ooh, and they call it bee pose.
That's a good way to describe it. Bee breath. That's cute.
Yeah. Bee breath. And then one of the kids yoga books that I use, it has that is bee pose, and so I'm like, of course we're adding in bee breath, and so we'll kind of play around with it and kind of notice the sensations of when we do breathing, full expanding and then pushing on our belly, and it's always
into it.
It's very cool because you just see the calming down of the system.
I love that you do that with kiddos too, because I think like, I work with adults for the most part, and it would be so nice. Like, I wish I could go back in time and just be like, all of us as kiddos, we had this kind of support, right? And there was this kind of information. How many of us would not be struggling with this today?
Yeah. To get tapped into what our body is telling us. Yes.
Yeah.
It's so powerful. Yeah. So powerful and so fun to hear the shares. There's a lot of,
I bet
the kids quotes. Right? No, it's so fun. Oh, the kids quotes in some of these interoceptive groups I lead just crack me up.
I know, and I wish we could go back to that too, especially the talk around bowel movements, right? Because
absolutely,
there's so much shame with it as adults, and we don't talk about it, so we normalize everything, and we're afraid to bring it up if it is a problem, and it's an issue. It's a big issue.
I might grab my little prop. I have this is the character I use, and there, when you talk about kind of the uncomfortable energy. Oh, I don't have it in the room, but it's a little squishy guy, and there's an intestine in it. I've got some models of it, but it's a little like outline body part thing. Every time I hold up the gut, Lola, they're like, help! So this is my squishy guy intestine.
Yeah. Okay, nice.
And obviously someone's had a little bit too much pressure and they've pulled the small intestine off of the large intestine base. But the conversations about poop with kids cracks me up. But there is almost always a like, I can't talk about this, and a big like reaction to it at first. But then the next couple times, once it's out,
just fine.
I know it's the intestine and it holds our poop. And so building in some of these things, it's a very like hands-on, I mean, and it's like super stretchy, squishy. So there's definitely like an intrigue of like all the fun things our guts can do. Let's talk about our organs. But there has been like a rote response of gross, I can't talk about this. So I'm just like curious from like society and like, is that something that why can't we talk about it? I'm so glad we're talking about poop.
I know, that's a good question, and I know there are other cultures where it is just something that is, there's not a shame around it, and people are like, no, we talk about this is it's a sign of health. It tells you a lot of information, and yes, it does. So we should share that information with people if there's a concern, right? Like,
yes.
I don't know how many times I would ask people about bowel movements, especially like in primary care, and they'd just be like, oh, they're fine. I'm like, well, what does fine mean? And they're like, well, I go like every week. I'm like, you go once a week? They're like, yeah, that's my normal. I'm like, okay, we have a lot to talk about, my friend. No wonder you feel awful, But it's normal. It's their normal. So it's fine.
Yeah. Gosh. Well, together, opening the conversations, right? And getting into the uncomfortable conversations. Because, I would agree. A lot of times the response is like, I've been told to not talk about this.
Response, right? Like, I'm holding it in, too. Like,
right? Absolutely.
All of it is held in. Like, oh, we gotta let it go. We gotta talk about it. Right?
I know. That was interesting. I did have that, like, because that is the body language. Yeah. That's really intriguing. That was a good catch. That is the, hold my words in, hold my body up, tighten up into like protective mode. Like, this is unsafe to talk about, or I've been told I can't talk about this for whatever reason. I don't know. I'm trying to remember. There, poop jokes and, all of those things that come out. It's a hoot. And sometimes I look around and I'm just like, is this real life right now? Like, these kids are just having a blast talking about organs. And it's a delight. It's a joy to watch and build that in. So, I love thinking about interoception and just this like amazing connection. We kind of talked about like how we can kind of track and notice those cues. Without feeling overwhelmed. So kind of building in the slowing down, maybe doing some deep breathing, drinking water slower, being more mindful when we're eating. Thinking about like, especially like sensory sensitive adults where like maybe those things are really intense cues. Maybe they're really muted if we're very disconnected from the body. But what are maybe 3 like beginner friendly practices that you feel like might be some helpful strategies just to kind of have like a more calmer relationship with their body, especially if we have maybe a little bit more heightened nervous system state.
That's I like that. Because there's that wide range of like, well, is it too much or is it not enough, right? And I think for a lot of people, it's kind of identifying what works for you. So like I was thinking like, oh, just like actually feeling into the sensations and like I'm comfortable doing that where it's like, oh, okay, I can put my hand on my belly and really like kind of feel what's going on. But I'm thinking back to this client I was talking about earlier. I'm like, she's not at a place where she can do that, right? Like for her, like that's too much. That's like, I'm uncomfortable even being in that position to like feel myself, right? So I'm thinking like that would be the first part is like, I wish that people could like really develop that awareness of like, okay, let's, feel and see like, where is our colon? Where is our small intestines? Where are some of these sensations starting to come from? So noticing them in the first place with that like neutral language and not going down the bad or good part, but just that like, ooh, this is warm.
The temperature. I love that with the temperature piece. That's one I hadn't ever really thought about.
Yeah, especially with like gut foods and like as you're eating, right? Like this time of year, I'm a very big like warm water drinker, you know, because I don't like the way that the cold feels when I'm already cold. So like even noticing those little differences where it's like, oh, I like a warm cup of tea. Well, how does that feel in your hands? How does it feel in your mouth? How does it feel as it's going down? You know, like starting to just kind of like track that whole process would be a really good first step, right? And noticing where it starts to feel maybe a little uncomfortable, or where you start to like, I don't want to think about this anymore, or like you need to disconnect from it. Yeah.
Yeah. I love that. Like the flowing through, especially when there's maybe the temperature contrast. Yeah. Like noticing it going down and then in, and then now I've kind of lost the connection. It's beautiful. Yeah. I like that a lot. Kind of tapping into things. What if people have really strong interoceptive cues? So that's one that I notice a lot. Like it's so loud in my body. Like I hear all of the noises so much that I'm actually like distressed by it and distracted by it. Like I need to like maybe reduce the amount of
sensations.
Sensations, or like the attention to it, because I can't focus on things in my life. Like I hear that being shared from an interoceptive complaint sometimes is like it's so loud. Like heartbeat is specifically one that I hear a lot. Like my heartbeat is so loud in my body that I'm having a hard time focusing on what I need to do. Like it's pounding out of my chest and I hear it. But I'm just thinking like gut awareness and things like that, because there can be a lot of gut pain that can probably be pretty loud cues in our body. I'm just trying to think those like really loud sensations, how we can kind of work on dampering things or acknowledging, and then like, whew, okay, now.
Yeah, it is. A lot of it is coming back to that, like, okay, this is uncomfortable. Yes, it is painful right now, but this is not the end of the world, right? This is not colon cancer. This is not, you know, I'm not dying. This is not an acute issue, right? Because that's something that definitely comes up a lot. But then, you know, there's really specific strategies I'll use with clients, especially like that, like painful bloating where there's a lot of cramping too. And one of them is like an abdominal massage where we get like, I'll have them use a little bit of like coconut oil and a couple drops of peppermint oil, right? Because peppermint is really anti-inflammatory. And then doing kind of a clockwise motion, just a gentle like movement of things, right? Because that then helps it to soak in and reduces some of that inflammation. But even just like putting your hands back on your body sometimes can like pull things back into, right? So that's a big one I'll use with people. And then it goes back to that, like, okay, maybe we need to do some twisting to get things out, or even tea's a big one that I'll use with people too. Like, let's have some ginger tea or some peppermint tea, depending on what's going on, to really like, again, because for a lot of people, like even having that warmth in the hand is enough to just like calm them down for some reason. I don't know what it is.
Neutral warmth. It's pretty lovely.
I guess so. Or it's like feeling so much somewhere else, and now you have something else to gravitate towards. It can kind of like, it is a little bit of a disconnect, but it's enough of a disconnect where you're like, okay, it quiets this down because now I can focus on this, but you're still in your body. Yeah.
To be able to regulate and use some techniques. I was just thinking of like starting at the ears and then going slowly down into like the body too, like being able to start at a place that's maybe less loud and uncomfortable and bringing that big old toning and input in, and then gradually moving it down to belly.
That's
especially
a really good idea. I haven't, I haven't really thought that one all the way through, but I love that idea.
That kind of interoceptive progression, we definitely start external because it's visually, usually I can see, so I can pull in my visual sense. So it's easier for me to think about my hands, that they are wet or that they are dry or that they are cold or I'm touching something warm. And then the progression moving towards internal, it's a little bit more accessible. Just when we're thinking about kind of building in some of those foundational pieces. So I'm thinking of like, if there's pain and discomfort and maybe a trauma response related to touching a distended gut that hurts and is sensitive, like starting a little bit more external, even like I'm visualizing watching my hand and I'm massaging my hand, and then I'm going in and giving myself some grounding squeezes. And then as I bring my elbows down, then they're actually touching my stomach. And then I can just release or something. I'm just thinking through the progression of movement that sometimes to be able to access, we've got to start out here first.
And then I love that. Yeah.
Yeah. It's been a fun one to think about, making things a little bit more accessible, because sometimes it's hard to listen to our cues. Sometimes we're so not connected that like, I don't even know what my heartbeat is telling me. And then we have the individuals that are very, very apparent with the cues in their body. That's almost distracting in the system. Yep. Too much.
Yeah. I think with adults, what I end up hearing with that is it's that mental chatter piece that comes in, right? Because it's like they get so hyper focused on, oh, I'm bloated and I'm uncomfortable. And then it's that rumination piece, like, oh, what's wrong with this? Why am I doing this? Like, why is this happening? So a lot of it too is that education part where it's like, okay, it's not the end of the world. I know it feels like the end of the world, but here's what's actually going on. And if you can kind of like work through that, then it gets better.
Yes. It gets so much better.
Yeah.
Mindset work is really powerful stuff, isn't it?
It is. Yeah. It really is.
But first, nervous system regulation, I think, is that foundation that I have heard you throughout the whole interview share is a big, huge foundation piece of the gut-brain connection.
Yeah, absolutely. They're not separate. They're very tied.
Yeah. Very much integrated. Well, Lola, this has been such a delight talking about gut health and some cool holistic tools and strategies. I love the temperature awareness and that kind of even mindful drinking of tea. I'm going to bring that one into my practice a little bit more with the ginger tea. I love that. I've been doing some peppermint, but I haven't had like a turmeric ginger one that was really lovely. I should bring that back into my awareness.
Yeah. Ginger is really good for motility, right? It does actually help to move things along. So for the constipated people, that one can be a very helpful thing. Yeah.
Excellent. Awesome. I'm sure the listeners are very excited and grateful for all these awesome strategies. Lola, can you share a little bit about any upcoming offerings you have and where people can find out a little bit more about you and your practice?
Yeah. So I am very present on Instagram with things. So that's an easy way to find me and learn more about what I do and gut health in general and different tips and tricks and things that way. And then one of the things that I'm very excited about is at the end of January, I'm going to be starting a group program for people with bloating and IBS and constipation, diarrhea. So that way we can really like talk through what's going on and how to work on it and really feel more empowered about what's going on with our bodies and how to address it. So rather than listening to all the noise on social media, even though I'm part of that noise, but
I love your videos though. Check out Lola's page because she's always doing these cute cooking videos and just like out in nature and like, let me tell you this gut fun fact, and you're out walking and you have some really awesome things to share.
I can make anything about gut
fantastic
health, which is really funny.
That's when you know you're in the thing that you're meant to do.
I can talk about poop all day. That's what I do.
I love it so much.
Yeah.
Well, thank you. Can you share your website name just so everyone can find it? And I'll have it in the show notes as well.
Yeah. So my Instagram handle is Lola MacLean DNP, and that's the easiest place to find me.
Excellent. All right. Well, thank you so much, Lola. It's been fabulous talking about gut health, brain health, some awesome new tools and tips and techniques. And thank you everyone for listening to the Sensory Empower the podcast. And until next time, have a wonderful day.
Bye.
Thank you for joining me on this sensory adventure through Sensory Empower the podcast. Remember, empowerment begins with awakening your senses. Subscribe now and embark on a journey of self-discovery and transformation. Until next time, may your senses guide you towards a life filled with peace, joy, and empowerment. Because true empowerment begins with embracing your senses.